Oh, there you go. It's now being recorded with the HR Human Resource Consulting Group, which is a premier provider of human resource services to help you, all of you as employers, to manage your most precious asset, and that, of course, is your people. So we appreciate you taking the time to be on to protect the health and safety of yourself as well as your employees. Robin has just got a fabulous background. She has a master's in science and human resource management and counseling from the University of Bridgeport, did her undergraduate work as two BSs, Bachelor's of Science in Business Administration and Computer Information from Mercy College. She's a recognized leader in her industry and is a member of SHRM. Many of you are, the Society of Human Resource Management, the American Payroll Association, and several other groups. She holds board positions as president of the payroll group, the TPG. She's a board member of WBDC, the Women's Business Development Council, which are friends and partners of the chamber. She's been a featured speaker there and is helping so many women entrepreneurs across this state. And she's co-chair of CBIA, the Connecticut Business and Industry Association's Labor and Employment Law Council. So, and we have a very close relationship, Robin, as well with CBIA, with Christy Pentima, the president, who's become a dear friend as well. Robin has also served as an adjunct professor for the management and business departments at UB, Sacred Heart, University of Connecticut, as well as at Bertus Magnus. So, Robin, thank you so much again for being with us, and we look forward to your remarks. And I'm sure you want this to be interactive as well, so we'll open up questions. So, Robin, the floor is yours, or the screen is yours.
Thank you, Bill. Thank you. And absolutely, please, nobody likes to listen to me, not even the dog. So I do make this as interactive as you'd like. Jump in with questions at any time. You can use the chat, you can unmute yourself, whatever you're most comfortable with. It's an interesting topic, and I've sort of added the kitchen sink here in some ways, because our cheese keeps getting moved every few weeks. Every time there's a new bill or a new act, if you're in human resources, or if you own a business, or if you lead a business, there is something new that you need to pay attention to. So while opening and reopening the workplace is sort of the topic for the day, there's also new constraints around that, and there's new requirements that you need to pay attention to just about daily. So I've put some of those things in here. If there are things that you know about, I can move more quickly. And if there are things that you need to know more about, I can slow down. So we'll go through the agenda, and again, I will take your lead. You all can share with me what it is you want to spend the most time on. So as of March 19th of 2021, all businesses have reopened in the state of Connecticut. We're going to take a little look at some of the guidelines and capacity limits for that. There are different guidelines and capacity limits for different businesses. We're going to look in general at offices, but there are different limitations, whether you're a zoo, if you're a restaurant, if you are a wedding venue. There are different things for every type of organization. We're going to look at employee considerations, health and safety issues. We're going to talk a little bit about vaccines and vaccines in the workplace, most importantly, and we're going to talk about the American Rescue Plan, which was really just released, and some of the impact of those outcomes on employers. So that was my hope for today. But again, my agenda is not nearly as important to yours. So please put your questions in the inbox. And I know a couple of questions came up before the webinar, so we'll address those as well. So plans for reopening, and I'm going to go through some of this a little quickly, so just stop me again with questions as we go through this. A lot of the content for this comes right from both the Connecticut website as well as from CDC Guidelines, which are updated extremely frequently, both the CDC as well as the government DECD website. So again, most of this is guidelines. Their requirements have been very much pulled back. But part of this is talking about how you as an employer, if you were not opened a year ago as an essential employer, how do you transition back? So if you're just coming back for the very first time and you have been remote for the past year, or if you've not been remote at all and you're reopening the workplace, what do you do? And one of the very first things you should do is to create an action plan for yourself and for your employees. And by doing that, you want to take a look at what are the risks within your environment and what risks need to be mitigated within your environment. To do that, and again, you'll have this, both the, I guess, the video as well as the PowerPoint. So you can use this if you'd like as sort of a takeaway, but taking a look at what hazards there are within your environment, what employees you might have at risks, those that might have direct client contact, or employees that might be at a greater risk because of the physical location that they have to other employees. What, if any, are the ramifications of opening to your business? What risks can you control? What, if any, can you transfer to another group, whether it's a third-party group? What, if any, can you eliminate? How can you control the environment and ensure the safety of your employees? And we're going to talk through some of those things, and I'm going to share with you some of the things that we did within our own work group to ensure that. You should have a response team ready. You will, if you've not been open, you will have people who become infected within your work group. It will happen. You're going to have someone that's going to come in positive. They will infect someone else within your work group. You need to have a plan of what you're going to do. What's the protocol? Somebody becomes infected. They're sitting next to someone else who's been infected, or they were in a meeting room next to someone else who's been infected. Or you find out you had 3 people in a conference room, even if they were socially distant, they were together. What do you do? How do you want to be notified? What's the plan for notification? When do they have to call you? Do you want them to call you after they know that they've tested positive? Do you want them to call you after you believe that they think that they've been sick? When their spouse finds out that they're sick, do you want them to call you? All of those things you need to think through, and you can be as hyper vigilant as you choose to be. And we have some employers who choose to wait and be a bit less conservative, if you will. All of those options are up to you. What you do want to do, though, is educate your employees and your leadership team as much as you can on the signs of COVID. You want to make sure that everybody is clear about what the symptoms look like and what those protocols are that you identify for your workplace. You want to make sure that people practice great hygiene, that they implement social distancing, that you become the police within your work unit, that if you see someone walking around unmasked, that you tag them on that. That you are as vigilant as you possibly can be, because people will take from you your whatever you are doing, they will follow your steps. So if they see you walk out of your office without a mask on, they will walk out of their cube without a mask on. So you want to make sure that you are doing by leadership and by example what you want others to do. You may have to make modifications to your workplace. We had to actually take over additional workspace. We had to take over a building next door and renovate that so that we could take people out of the existing workspace and move people to create additional space. You might have to do something similar. You might find that you have enough workspace. You might have to find that you need higher panels in your desks. You might find that you need to put people a desk apart. You might find that you want to keep visitors out or restrict visitors if that's possible. Again, some of these things are going to work for you. Some of them are not. Some will feel awkward. Some might take some time to feel comfortable with. You might want to limit in-person meetings or limit them to larger conference room spaces. You want to make sure that you're disinfecting and sanitizing, but all of this should be created in a plan that you create for your workplace, and everyone should know what that looks like. And this rapid response protocol should be communicated to all of your people. Inside of this, it should include what, if anything, you're going to do with your employees when they come in during the day in the morning. Are you going to take temperatures? Are you going to ask them to take temperatures at home? Are you not going to do anything at all? Are you going to ask them any health questions? Are you going to choose not to do that? Again, around contact tracing, around exposures and confirmed illnesses, how are you going to manage those? What policies need to be updated in your handout, in your handbooks? Are there absence policies that need to be changed or changed temporarily? The one thing that you can expect is that you will need to be probably more flexible and more adaptable than you've ever been in the past, because whatever you thought was normal is no longer normal at all. So all of those things are part of what you need to consider in your reopening plan. And the one thing that you should keep in mind is that being uncomfortable is probably the new norm. Before I move forward, I just want to see if there's any questions in the chat. Is there anything I can answer for anyone at this point? I think someone asked about getting a copy of the slide deck. Absolutely. Any other questions so far? All right, let's move forward. Let's take a look at some guidelines and capacity limits. So again, what were requirements a year ago for essential businesses are now considered guidelines. So now that the limitations are quote unquote 100% with social distancing requirements. Those requirements in many cases are guidelines. The 6-foot spacing is now being rethought and reconsidered. But again, it's what you're comfortable with. And most importantly, it's what your employees are comfortable with. We found when we opened, well, we never really closed, but we found by a year ago, spreading our environment out over 2 different buildings, we created this environment where people felt safe. One of the things we didn't expect is that we also created sort of this self-contained unit, so that by keeping others out, we created an environment that when clients now start to want to come back in, we have an issue where people don't feel safe with people coming back into the workplace. So we now need to begin the whole education process all over again. You know, how to make employees feel comfortable with others coming in, because they now trust that their coworkers will take their safety at the uttermost importance. But how do they know that a client coming in will be as cautious about their safety as their coworkers will be? So it's an interesting dynamic, and we're beginning to live through it. So the locked doors, if you will become unlocked soon. And it's very interesting to see. And some of you may be opening your doors to the public for the very first time, and how to make your people feel comfortable having retail public come in, maybe clients come in, serving the public. How are you going to educate and make your people feel comfortable working their way through that? And again, you know, a lot of this is about education. A lot of it is about communication. We have continued to take temperatures in our office. We have gone from a monitoring process where someone is actually in charge of taking temperatures to a self-monitoring process where people walk up to a machine. And that was a big shift for us. Giving up the control of knowing that someone's temperature was actually being checked was a big shift. Again, we became very control oriented about our own safety, but you have to consider what's important for you and what you're comfortable with. We encourage our employees, if they do not feel well, to stay home. You again have to draw that line and see what you're comfortable with. People who are ill should stay at home. Employers are now starting to feel that sort of yin and yang. We're getting a lot of feedback from our clients who are beginning to feel, I would suggest, maybe a little abused about emergency sick and emergency leaves, and feel that people might be taking advantage a little bit of some of those things. And again, it's a very fine line. We're all dancing on top of a pin. You don't want an employee to come in who's not well, but you want to be able to provide services to your clients and continue to have profitable organizations and businesses. So again, I encourage you to educate your employees and continue to support them to make the right choices for both themselves as well as the organization. We still do confidential health screenings. Again, many organizations have let those go. We still do that. Hand sanitizers, we have them throughout our organization, both standing units at every desk. We have them at any common shared space, copy machines, printers, anything where people are using product together. We have posters out about social distancing, about hygiene, about information for 211 if they feel symptoms around COVID. Those are all things that you can do to make your employees, again, feel comfortable or safe. And we have identified individuals that can work from home, that we feel comfortable having work from home, and we've identified high-risk individuals that we've continued to have work from home. We're comfortable with that. Workforces are beginning to want to have those individuals to come back. I'm going to show you some statistics in a little bit. Where employees sit right now and where employers sit may not be in the same place. I think we're going to start feeling that friction probably more over the summer. I think we're going to have an interesting fall. We'll talk about that more in a little bit. Workplace travel is becoming another yin and yang. In many cases, employers want travel to begin again. Employees are not necessarily comfortable traveling yet. And then you have the other side of that, where employees want to go and begin personal travel, and employers are not comfortable yet with employees coming back to the workplace yet traveling. Have any of you had to deal with either one of those scenarios yet? No one. So we're dealing with both sides of that. Yes. And if they're not vaccinated. Yes. So it's challenging on both sides. So if someone's vaccinated, and we're going to go through some of those guidelines in a moment about travel and vaccinations, it's easier if the person is vaccinated, of course. But if you have someone who's not vaccinated and choose to travel for personal reasons, it can create some challenges within the workplace. And if you have employees that choose not to get vaccinated and you want them to travel for business, that can create a challenge for you as well. And we'll go through the quarantine process, Eve, in 2 seconds for travel for both business and personal. But it's a conundrum, quite frankly. And again, we're all very much on a balance beam. Again, encourage you to look at your workplace, make sure that any signage that you put up is both in English and any secondary languages for those individuals who speak a second language, and to make sure that your facility has enough both product as well as posters and notifications up that everyone can be communicated to in a clear manner. In terms of visitors, many businesses have opened up to external visitors. I told you just recently about the challenge that we're managing. I encourage you, if you are going to allow for external visitors to come in, that you use the same controls that you would for your own employees. If you are managing temperatures, manage temperatures for visitors coming in. If you're contact tracing with your visitors as well. If you're making people use hand sanitizers when they come in as your employees, have your visitors go through the same. If they're clients, they will understand the safety of your employees is just as important for them as it is for you. So don't be afraid to treat your clients with as much care as you do with your employees. So these are capacity limits that are effective as of today. Some of these may or may not be relevant to those of you that are on the phone. Private gatherings tend to be a bit more limited than commercial gatherings. I don't know if any of these are important to you all. I found it very interesting that graduations actually have a much larger cap, no pun intended, than some of the other private gatherings. But again, these are all on the Connecticut website. But the most important thing to note is that no matter what you do, face masks and social distancing are still required. So important to note. And outdoor venues, as we know, as of last week, actually last Friday, outdoor venues will all be open at 50% capacity with up to 10,000 people. So, and fairs will all be opening at 50% of last year's capacity, which I believe was 0. So we all have that to look forward to this summer for those of you who are comfortable. So let's talk about employees in general. And this sort of gets into the yin and yang that we talked about a little bit. This actually was published yesterday. Almost half of our workforce has been working from home, 42%. 61% of our workforce, of our white collar workers, say that they want employers to let them continue to work from home when the pandemic is over. 80%, just about 80% of our companies say that they want their employees to come back to work. Those two numbers are in complete opposition with each other. We're going to have to figure that out. I don't quite know how we're going to figure that out, but we're going to have to figure that out. Because what we're saying as employers or business owners is that we want you back, and our people are saying we want to stay home. So, and if anyone is trying to recruit right now, we all know what the labor market looks like. So drawing a hard line in the sand probably isn't going to be the way that we want to take this. And 29% of our working professionals would tell you that they would quit their job if they cannot continue to work from home. I had a nephew share with me, an adult nephew this weekend, who has a fairly high-level position for a Fortune 100 company, that he was offered $150,000 more to go work for a company that was in Greenwich. And he turned it down because right now he is able to work from home, and being able to work from home with a 2-year-old baby at home right now and having that life balance without a 2-hour-a-day commute is worth the $150,000 a year. And that was life-altering to me. I mean, hearing that as a business owner, as an HR professional, it sort of took me back and made me rethink how we need to be consulting to both our clients, other businesses, and probably all of you on the phone. It says a lot.
Robin, just a quick comment for you. We actually just unveiled our first formal remote work policy at our company as a result of all of this, as we start eyeing when folks will start making some tentative comebacks to our office space. We're hoping that we can at least accommodate those that may want to work from home on a part-time basis or a full-time basis. So we're taking steps.
You know, it's going to be an interesting process, Amanda. And I think for those people who are patient, for those employers, those HR professionals that are patient and take a slow roll on this, I think that would be the most beneficial approach. Anyone who tries to bring people back in a dramatic fashion, I mean, obviously we can't talk to that with retailers, right? I wouldn't be making this suggestion to a retail client, but for a professional or a white collar environment, I was on the phone with a company who we have been working to try to bring in as a client for almost 2 years. And they've gone from 150 lives to 36. And they said, we're bringing everybody back July 1, no matter what. And I said, why is that? And they said, we want everybody vaccinated. We want everybody in the office. So are your people happy working from home? they're happy, but we're not happy. And I listened, right? They're not they're not a client yet. So I listened. But the reality is, I think this is where we're really going to need to listen to employee needs, and we're going to need to look at productivity, and we're going to need to see what's gotten done in the last year and what we've lost and what we will lose, and look at the gains, and be really smart about employee considerations. I think we have a lot to lose, but some of this is opinion statement, and I'll certainly state that, but it will be interesting. I think the next year or two is going to be very interesting, but I think the pandemic will have forever changed how we work. Certainly how remote workers work. So the other parts of what we need to look at, and this goes both ways. In some cases, employees don't want to come back because they're afraid to come back. You know, there are people that are afraid to be around other people right now still. There are people who are terrified to be out in public. There are people who do not want to take their masks off. There are people that are afraid to still go out to dinner. They're afraid to people who are afraid to drive in their car without their masks. And we need to think about those folks too. There are folks that do not have childcare. There are folks that are afraid to put their children in childcare. And all of those things are going to have to be managed for us to get a workforce back, whether it's remote, partially remote, or in the office. And we're going to have to make all of those balances and considerations as we move forward. And we're going to have to think about what kind of line in the sand we want to draw when an employee refuses to come back to work. And what's the conversation going to look like? Are you going to require somebody to come back? If they don't want to come back, are you willing to lose that employee? You could probably let somebody go, but it's a very challenging labor market right now. And you have to take into consideration the cost of replacement. So all of those things, while they're employee considerations, they're certainly employer considerations as well. So let's look at the health and safety side of these things now too. So you have the issue of quarantine and isolation, and obviously the difference between both. Quarantine is where someone needs to be kept away from others, and isolation is when someone is infected with the virus, even if they're being isolated from others, if you will, because we know that they're infected. So quarantined is someone who may have been exposed. Isolation is someone who definitely has been exposed. So when you need to quarantine someone who's been in your workplace that may have had contact with someone who's had COVID, if they've come into contact with them within 6 feet, for accumulation of, right now, the guidance, and this has changed, it's been a moving target for 15 minutes over a 24-hour period. Again, expect this to change because it has changed. Someone who's provided care to someone with COVID, someone who's hugged or kissed or shared eating or drinking utensils, been in a car, sneezed, coughed, someone who's been in close contact. And what do you do about someone? Well, right now, the CDC guidelines are that, they're guidelines. 14 days after last contact with someone with COVID should be quarantined. They should be monitored for fever, cough, shortness of breath. They should stay away from others. You can reduce quarantine by returning after 10 days after exposure without testing, or they can return 7 days with a negative PCR test, or 5 days or later. Now, again, these are guidelines right now. Some companies are requiring a rapid test followed by 3 days later, a PCR test, and then returning to work. So it depends on what your tolerance is for risk, right? If you are willing to, so what we do right now, if someone comes into our office and says, I think I might have been exposed, well, God willing, they won't have come in the office. They will have called in and said, I might have been exposed to someone who had COVID. I was with someone over the weekend. They tested positive. We'll ask them, please go get a rapid test. And then 3 days later, and that comes back negative, we'll ask them to please wait 3 days and go get a PCR test. If the PCR test comes back negative 24, 48 hours later, we'll have them come back in the office. More than likely, that's 5 days. If they come back positive on either one of those, we will make them wait until they are symptom-free, and then we'll have them come back after that, 7 days typically, after they are symptom-free. It's all about risk tolerance. It depends on how risk tolerant your environment is. It's very easy to bring somebody back. If you bring them back too soon, you may get others infected within your workplace. Again, they're guidelines, they are not requirements, and it's all according to what your risk tolerance is for getting other people ill within the workplace. Individuals who have confirmed cases of COVID within the past 3 months that do not have to quarantine unless they're exhibiting symptoms. We're seeing more and more cases of people, especially young people, who are getting COVID 2 times within 3-month periods. So some of this you can't depend on because we just don't know enough about the disease yet. So again, this gets back to what your risk tolerance is within the workplace. Individuals who test positive can end their isolation if it's 10 days since their last symptom or 24 hours with no fever or medication and the symptoms are improving. Loss of taste and smell may last for long periods of time. For some people, it could be weeks. People can continue to test positive well after they've ended their isolation. So we talked about travel a little bit, and I want to just check in. Are there any questions before we hit travel? So we talked about travel, and this has been a hot topic, I think, for a lot of folks, and it sort of cuts both ways. One of the questions that came up through the chamber this past week was about people coming in from different parts of the country. Specifically, I think in the question that came up had to do with board members coming in from different areas of the country into an organization and people being uncomfortable within the corporation, having people travel in. Right now, as of I think last week, if people are vaccinated fully and they've passed the 14-day mark from their last dose, they can travel within the US. They do not have to test before or after travel. And you can feel comfortable. You should feel comfortable. You may feel comfortable letting them into your organization. That doesn't mean that you don't have to allow them to mask. You can still ask them to mask. And you can still certainly follow your own corporate protocol in terms of them coming in. But again, they should still stay 6 feet apart from others and follow whatever your protocol is. The same would go for your employees, whether it's personal travel or work travel. That said, if they are non-vaccinated, whether it's for work or for personal, every airline is managing this differently right now. Some airlines are requiring in advance tests, negative COVID tests. Some are requiring it a day before, some are 3 days before, some are requiring it before you get back on the airline to fly back to wherever you're going. And Connecticut has its own reentry process when you get back. They are requiring when you get back that you also self-quarantine when you return and that you get tested again before you come back into the workplace. And every workplace can have their own requirements when you get back if you are non-vaccinated. Some workplaces are not allowing you to come back until after 10 days of quarantine with a negative test. That is up to you and your protocol. The only thing I encourage you to do is to be non-discriminatory in the implementation of your policies. That doesn't mean your policies can't change. They just shouldn't change for Sally and Dan. They should be the same, but they might change from last month to this month because we know that everything is changing from day to day. So right now, this is the domestic travel for non-vaccinated persons policy. I can guarantee you within the next 2 months, this will probably change again. So Eve, did this answer your question?
Yeah, actually, it wasn't a question. I was responding to what you had said. Our policy follows the CDC guidelines. If one of our employees who is not fully vaccinated decided to travel, they would have to conform to what is actually up on the screen now. So I wasn't asking a question there. I'm responding to something you had said. What did come up earlier for us is what constitutes travel. If we get in a car, if a salesperson gets in a car and goes from point A to point B within their own state, is that travel? And I spoke to somebody at CBIA who said it would get very cumbersome if you're tracking, county to county within Connecticut.
Right.
So I guess, and again, each company has to evaluate what is best for that company. But I guess if you leave the state, that would constitute travel, even if you're going from one private home in Connecticut to your other private home in, say, Vermont. When you return to Connecticut, before you come back to the workplace, if you're not vaccinated, you would follow the after travel guidelines.
Right. And it also matters, quite frankly, what state, right? I mean,
Yeah.
right now, if you were traveling to a hot state, if you were going to New Jersey, I would look at that very differently today than if you were going to Vermont. So I think those are things that need to be reviewed too and looked at. And the state of New York is a very different state too, if you were going county to county, than if you were going county to county in Connecticut, where you could do one in an hour and a half, the other one you could do in 10 hours. So I understood. And a lot of this is very discretionary. And as long as we're being discretionary and not discriminatory, it's I think that's where we run into challenges.
We do remind our employees that we follow CDC and state rules. So it's incumbent upon each employee, depending on their state, to check those guidelines, which, as you say, can change from week to week, but it is the employee's responsibility to check where they live.
Absolutely. Absolutely. Thank you. So let's talk about customers, because this can get uncomfortable. We've had one COVID scare within our office, and it was a client, and it's why we closed out client meetings within our office. We had a client who was very excited and came to our office to share with us that they sold their business, and we were thrilled for them. And the day, actually, it wasn't the day after they left, it was probably 4 days after they left, we found out that one of them tested positive for COVID. And we had a group of employees that had a complete meltdown that we allowed them into the facility. So lesson learned for our leadership team. One, we learned, that was when we learned that we had this microcosm of people that very much felt that we had this safe environment. I had to be careful about how we let others come into it. And two, that we needed to ensure that we treated customers the exact same way that we treated employees. So don't be afraid to have people wearing face masks if that's what your employees do. Don't be afraid to refuse your businesses or your clients to refuse service to them if they're not wearing masks. Know that you can require medical documentation now for not wearing a mask. I don't know if any of you saw what happened on an airline last week. It got pretty dicey, but that was because an employee of an airline violated their own airline policy for requiring a 2-year-old to wear a mask that had a medical issue. In that case, you can't require it, but again, you need to use common sense as well. In-person meetings should be avoided as much as possible. If you need to have them, as long as you're socially distant, you should feel safe. Anytime you can increase physical space, use services, delivery services remotely, obviously using curbside pickup or delivery whenever possible, you can and should. For those of you who are in manufacturing environments, you're probably doing all of these things, so I don't need to go through them. But the one that I do want to point out, if you're in an office that's not been opened yet, I'd encourage you, have your heating and cooling folks come in, change your venting systems so that your AC systems are cleaned out, because they probably haven't been used the way that they were in the past, so that you can make sure that your airflow is as clean as it possibly can be. Again, just trying to improve and as much as you can for the welfare of your folks and yourself. And again, much of this applies to manufacturing locations, but most manufacturers have remained open, certainly in the state.
Hey, Robin, as the water utility on the line, there is also a CDC recommendation for flushing the water service lines in the buildings that have been vacant for some time. Our utility was part of kind of getting that together for the state of Connecticut with the local DPH, but it is on the CDC website. So just something to keep in mind if the building's been shuttered for some time.
That's great, Amanda. Thank you for sharing that. That's a very good point, a very, very good point, especially when I would imagine when it comes to drinking water too. That's critical. Thank you. That's a very good point. Again, if you have internal doors and you can keep them open, you're encouraged to do that. The least amount of touching, even though there's been a lot said about transmission through touch. A lot fewer people have been sick in the last year than we've ever seen before. There's a reason for that. It's because our hands have all been clean. So the more we can keep this up, I think the better health we can all share. So we now make sure that people wipe down before IT comes over to your desk, that keyboard gets wiped clean. IT uses that keyboard, it gets wiped clean again. All of those are just good practices, I think, for all of us going forward. So there's a lot of things I think we'll move forward with from COVID that we've all learned. So I want to spend a few minutes on this, and I know that we're closing in, so I want to just hit a couple of key points before we end our time here together. So I want to talk about vaccines in general. And it sounds like a lot of folks are talking vaccines and having people vaccinated already in travel, and that's all great. I'm curious to know, have any of you on the phone mandated travel, mandated vaccines? Anyone here mandated vaccines in their workplace? Any of you considering it?
We're hoping that our employees will get vaccinated. We've actually set up a clinic with one of the local health networks to get our employees vaccinated.
But falling short of requiring.
Yeah, and Robin, I was going to ask that question. You know, can employers, are they legally entitled to mandate? And I'm sure you're going to get into that.
So it's an interesting question, Bill, and certainly one that's been bounced around quite a bit. And the question is, should you, can you? You can. There are some legal things, there's some pitfalls. You need to be careful with ADA. There's some EEO pitfalls as well. You need to make sure there's no medical reasons why someone can't take the vaccine. And there are some vaccines that some people can't take. So there are some religious exemptions as well. So you need to be careful of all of those things. But there are some questions about the ethical side of it. Do you mandate it? And interestingly enough, I got to see a piece, I want to say it was the day before yesterday. There are very few employers in this state that are mandating. And Connecticut truly was a leader in having our constituents vaccinated. We've done a fabulous job in this country in getting everyone vaccinated. And I do applaud the administration. We've done a wonderful job. And that said, it's interesting. So far, we've had 2 employers that have come out to mandate vaccines. And one of them was the Jewish Services, the Jewish Senior Services Agency, and they have mandated. And their perspective is they are serving the elderly, and without mandating, their fear is that their clients would be at risk. So the reasons are certainly valid in terms of why they're doing it. And the other side of that is, I'm sure there are some employees that, might take the perspective that they shouldn't have to take the vaccine. And their perspective is that there's other jobs, I'm sure, that could be available for them if they choose not to take that vaccine. So the short and long of it is, you probably could. You need to make sure that you're not violating anyone's EEOs or ADA rights to do that. If you choose to mandate, you should make sure that you do have policies. You should make sure that you have waivers for any kind of accommodations that need to be made. And if you are going to mandate, you should consider incentives for those that do get the vaccines. People are doing anything from additional paid time off to giving people time off to go get the vaccines, to making sure that those before the ARP came out, to those who got the vaccines, that if they got sick, that they certainly had time to recover outside of their traditional paid time off. So it's an interesting question. It's one that a lot of employers are considering. I think right now, many employers are taking the educational route by educating and re-educating about vaccines, and hoping that people will take the choice to take a vaccine rather than not. But it will be interesting to see where this all comes down. And certainly, so let's see, not all of us would like to, you'd like to require it. And interesting, but you're waiting to see if the CDC gives it final approval. So it's an interesting, so Betty Lynn, somebody had raised the question, can you require something that's not gotten FDA approval, is the question that's come out in the past. And right now, the EEOC has specifically come out and said, yes, you can. And someone else has said, not all of us have had it. Oh, but by the end of tomorrow, 2 of us will have it. That's great. That's congratulations to you guys. I am grateful that I am vaccinated. It's a wonderful thing. It felt like my second baptism. Just remember, once you get your vaccine, it doesn't mean that you still don't need a mask. You still need a mask because you can still be a carrier. My daughter graciously got hers at the beginning of January, so she's been vaccinated much longer than anyone else in the family, because she works for a health for a hospital, and reminds us all the time that she can still be a carrier even though she may be vaccinated. So in addition to paying for people's time, keep in mind that not everyone gets the vaccine completely for free. So while the vaccine may be for free itself, in some cases, the clinical portion, there may be a charge for getting that vaccine depending on where the person goes. So you may want to consider paying for that. I have not seen a charge yet for a vaccine, but it is my understanding that there can be a charge for the clinical portion, even though the dosage itself might be free. Okay, I want to spend just a couple minutes on emergency sick and the emergency FMLA extension under the ARP and the COBRA subsidy, if that would be helpful for you in my last 5 minutes. So I'm going to just ask you to do a quick shout out. Will this be helpful for you? Anybody?
Yes, please. Yes, go ahead, Robin, please.
All right. So this came out of the big change really about 2 weeks ago. We're still waiting for some guidance on the COBRA piece, but we've actually gotten our letters, our model notifications. So I'm just going to give you a quick blow through of what's different. So under the original CARES Act, we had these 2 banks of time. One was 10 days of emergency sick time, and the other was this 10 weeks of emergency family medical leave time. And that was required pretty much for companies under 500 lives. That was extended at the end of December by President Trump through April, through the end of March. on a voluntary basis. This leave picks it up again to April 1st to the end of September. It is discretionary. Again, it's voluntary. However, the biggest difference is emergency sick, the 10-day bank gets reset. So it had not been reset in the December change, the add-on of voluntary. So now the new 10 days have been reset, meaning people get an additional 10 days of emergency sick, and I'll go over the why. And the employers can get a tax break, tax incentive, tax rebate, however you want to call it, tax credits for those 10 days, up to $511 per day, maximum of $5,110. The leave is discretionary. However, you need to be consistent and non-discriminatory on that 10 days, meaning you can't decide to give it to Sally and not give it to Joe. There is some change around the family medical that I definitely do want to point out to you. So what you should know is that the reasons, there have been 2 reasons that have been added to. So originally, there were basically 6 reasons that you could give emergency sick. 3 of them were about taking care of me, and 3 of them had to do with me taking care of you. So if I were subject to a federal, state, or local quarantine to take care of me, meaning I had to isolate or quarantine to take care of myself due to COVID, or I had been advised by a healthcare provider to quarantine because of concerns due to COVID, or I was experiencing symptoms due to COVID, I was eligible for the 10 days. If I was taking care of you because you were sick due to COVID, or I taken care of a child due to COVID, or there was some substantial issue like COVID that I was taking care of somebody else, I was also eligible for those 10 days. The difference was if I was taking care of myself, I was eligible for the $511 per day. If I was taking care of someone else, I was eligible for 2/3 pay, up to $200 a day for those 10 days. What's been added are these 2 new pieces, 4 and 5, where the employee is seeking or awaiting results of a diagnostic test or medical diagnosis of COVID. So you're waiting for the test results, right, to see if you have COVID. We all sort of assumed that, but they put that in black and white. Or you're waiting for or recovering from a COVID-19 immunization. So you get sick from the COVID test or the COVID vaccine. You basically get sick as a result of it, or you become disabled as a result of it. The second shot got you a little bit sick. Whatever that is, those 10 days can now be used to cover that, or even the time for you to go get the shot. So again, those 2, 4 and 5 is used to cover you up to the $511. So that's new. And again, those can be returned to the employer as a tax credit. They've changed slightly enough to create chaos on the payroll side, how the tax credits are going to be taken, but you're still a tax credit. Most importantly, so we've gone through this, but most importantly, I want to talk about the FMLA because that did change a lot, and I don't think people really know this. This changed dramatically. The FMLA is no longer just for taking care of a child, which it was. The 10 weeks, the way that it worked is the first 2 weeks were unpaid, then you got 10 weeks taking care of a child who did not have either daycare or school closure. Now it's expanded. It's any one of those 1 to 8 reasons I just went over, in addition to any school closures or unavailability of childcare. There's 12 weeks of paid FMLA, up to 2/3 pay to a maximum of $200 per day for $12,000 in the aggregate. So the banks don't reset though. So while you got the extra 10 days, if you will, for emergency sick, these banks don't reset. So if somebody has used their 10 weeks, they're not going to get another 10 weeks. They'll just get 2 weeks. So if any of that was confusing, you can read the slides. or you can email me and I'd be happy to answer it for you. I'm going to take 5 seconds to go through this because we're just about at time. Cobra Subsidy, I still have nightmares from the Cobra tax reduction from 15 years ago. This is the ability for, or not the ability, but it is basically to provide people with COBRA to help them pay for health insurance that may have lost insurance due to the pandemic. So basically anyone who has lost their insurance starting April 1st, ending September 30th, if they've been involuntarily terminated or lost hours and they're eligible for COBRA other than gross misconduct, they'll have their COBRA covered from April 1 to September 30th. The bigger challenge here, so it's for themselves, their dependents, as long as they were involuntarily terminated, they will be able to have their COBRA paid for. You'll be reimbursed as an employer by a tax credit. The challenging piece of this is that employers will also have to go back to people who were previously terminated, going back to November 19. So basically an 18-month period, to anyone who is involuntarily terminated or had their hours reduced, make a new offer of coverage, or anyone who had COBRA and dropped it because they couldn't continue to pay for it, they would have to get re-invited to join. They'll be offered again the opportunity to join your current plans. They'll be offered the lowest current plan available, and they will be paid for through a tax subsidy. Those COBRA notice languages have to have changed as of last Friday. Even though the model notices just came out yesterday, your language on your COBRA notices actually had to change last week. So if you didn't do that, I'd encourage you to do it. There are some limitations around that. Not going to spend a lot of time around this, but it basically says you can't double dip. If you're an employee and you've got coverage under somebody else, you can't now take the free coverage against your former employer. You can't double dip, but that's the COBRA subsidy. What questions can I answer for you in the 4 minutes late that we are?
Are there other questions? Other questions of Robin? Please unmute yourself, Nance. Can we do that? If there are some questions. Robin, I think you've answered the question, but I had one manufacturer. As you point out, you know, the manufacturing was always deemed essential in this state across. So that sector, of course, has the most experience, at least with respect to production people.
For sure.
The question that I had, and you've answered it, is about mask wearing. So, you know, we've gone, you know, 13, 14 months of production people on the line, you know, wearing masks. And the question from one of our members was, you know, 99.9% of my employees have been vaccinated by May 1. Can I allow them to take off their mask as a matter of, and I think we know the answer. And the answer is no. You know, because of the, you know, particularly if you're doing physical labor, right, you can get a little tired. And I know I'm working out at the gym, you know, and you have that mask on. It's tough. It's tough to breathe sometimes. So I will share your response with him as well. I did say ask the medical.
Yeah, I know it's hard. It is hard. It is hard. It's going to be harder in the summer. It's hard.
Yes. Yes, on the production floor. It absolutely is. So.
The challenge is all of the vaccines are not 100%. Johnson & Johnson is, you know, in the high 70s, low 80s. That's people right. Can still get COVID. We're still transmitters.
That's right. Well, listen, we are gonna bring this to an end. We will share the recording. We will share the slides. Thank you, Robin, very, very much. And I'm going to say, Professor Robin, how blessed these college students are to have you. You know, I always wanted to be a fly on the wall in one of your classrooms, and now we have been.